Good morning, it's Friday at 9 a.m. I'm Lynnette, this is my oral med pass video. So I am going to do my morning med pass, and I'm going to start here at the MAR, but before I do anything, I'm going to do a little bit of hand hygiene. And then I'm going to look and see who I've got at 9 o'clock. Well, my first patient is Annie Ma, who her birth date is 1950-12-1950. Says on here she has no known allergies, and it looks like I'm going to need to give her Coumadin, Cardizem, don't need to give the Wellbutrin, and some Tylenol. Okay, so I'm going to start my little cup, and I'm going to start here with my Coumadin. Looks like she needs 15 milligrams, and Coumadin is this straw here, and they're 5 milligram packs. So it looks like since she needs 15, I'm going to have to get 3 of those. Then Cardizem up here, and she needs 180 milligrams. It turns out that that's what they are in each pack, and there's one 180 milligrams. And then she's going to need some Tylenol. That looks like 650 milligrams. We'll grab that out of there. Okay, first check done. Next check, I'm going to check them all against the MAR, so I'm going to go backwards. Tylenol, 325. We're going to need 2 of those because her order is for 650. Okay, and Cardizem, 180 milligrams. She needs 180 milligrams, so I'm only going to give her the 1. Then Coumadin, 15 milligrams, and each one of these is 5, so I'm going to have to give her 3 of those. Second check done. Okay, so now getting them in the cup, I'm going to go back the other direction again. I'm going to do Coumadin, 5 milligrams, 5 milligrams, 5 milligrams. Those go in the cup. Third check done. Cardizem 180, one pill. Cardizem 180. Third check done on that one. Tylenol 650. So I'm going to need 2 here. Into the cup. Third check done on the Tylenol. Okay, I'm going to put that back. Now that I'm done with the meds, I'm going to lock up the cart. Then I'm going to have to do a little bit of investigative work on my meds. So first I'm going to look up the Coumadin. Well, Coumadin turns out to be a high alert med, and I would have needed to check her INR and PT, which I did, and they were all right. I also had the original order checked by another healthcare provider, and I am going to check her to make sure she doesn't have any kind of bleeding. I'm also going to check her pulse, and then because she has Cardizem, I'm also going to check her pulse and blood pressure and make sure that they're within the normal ranges. And she's got Tylenol for pain and fever, so I'm going to go ahead and check her temperature. And then, because Tylenol and Coumadin are both increased risk of bleed, I'm going to be really, I'm going to pay really close attention to that when I go and talk to her, make sure she doesn't have any of the adverse effects like that. Okay, so I've checked all my meds. Now it's time to go to the room. So I've got my med cup and my envelope. First of all, this is the room. Knock, knock, knock.
Come in.
Good morning. My name is Lynnette, and I am going to be your nurse today. I'm going to give you some medication. First, can I ask what your full name and date of birth is? While I'm asking her that, I'm also going to do hand hygiene and draw the curtain. And maybe do hand hygiene again, because I probably should have drawn the curtain first. So, hand hygiene again. Okay, can I ask you your full name and date of birth?
Annie Ma, 9/3/1980.
Okay, and I'm checking you have that on your band. That's what it says there too. Nice to meet you, Annie. I'm also checking your allergies. Looks like you're allergic to penicillin. Can you think of anything else you're allergic to?
Boys.
Yeah, me too sometimes. Okay, so I brought them all to make sure that I have that you are in fact Annie. So this is the medication for you. Okay, before I administer the medication, I'm going to sit you up in bed a little bit. Is that good? Do you feel like you could swallow in that position? But before I do, I got to do a little bit of other things. I felt like I was getting ahead of myself, Annie, and I was right. What I'm going to do first, because the kinds of medications I'm giving you are things one's for your blood pressure. I need to check your blood pressure. And then the other one is for your heart. It kind of helps your, or the one that's for your blood pressure is also for your heart. So I'm going to take your blood pressure, I'm going to listen to your heart, and I'm going to listen to it here for 60 full seconds. Okay, that all sounds good. I'm also going to take your temperature. While I'm doing that, can you tell me, are you having any pain today, Annie?
Yeah, I got lots of pain.
Can you tell me where that's happening?
In my knee.
In your knee. Okay, that's where you had the surgery, right?
Yeah, I think so.
Can you tell me, from on a scale from 0 to 10 being the worst pain you've ever had, can you tell me how bad it is?
Definitely an 8. Definitely an 8.
An 8. Okay, and can you describe it a little bit? Is it sharp?
Sharp.
Throbbing? Any of that?
Sharp. It throbs. It's stabbing. Pressure.
Okay, well I got a couple of medications here for you. Like I said, one of them is for that pain actually, and so that should help a little bit with that. That's the Tylenol, and then I also have a couple of other medications. One's to help your blood not clot so quickly, since you did have the surgery. That's something that's of concern. And you also have one for your heart that helps with your blood pressure and helps your heart not work so hard. So did you have any questions about that?
No, I feel pretty confident in you.
Thanks. That's nice to hear. All right, well then let's go ahead and get your meds going here. Here's your first one. Here's your second one. Just don't water all over you. Here's your third one. Gonna get all of the debris from those. Okay, I'm gonna throw that in the garbage. All right, I noticed that when I poured the water that you've got plenty of water. Is there anything else that I can get for you?
The clicker
Yes, you do have your clicker here, and also
for the TV.
Here's your call light. And while I'm handing you your call light, I'm gonna put your bed back down. Did you want to sit up for a little bit, or do you want me to put the head of your bed back?
I want to watch TV.
Okay. We'll go ahead and leave you in that position. Does that feel good for watching TV?
Yeah, thanks.
All right, and your call light is right next to you. All right, so it looks like your room is fairly tidy. Remember, I said my name is Lynnette, so if you need anything else, be sure and give me a call. And I noticed that, okay, your bed is down, you've got your water, you've cleaned up your room, and then before I leave the room, I'm going to do some more hand hygiene. And then I'm going to pull the curtain. Do you want your curtain open or shut?
Open, I want to see out.
Okay. All right. Well, you let me know if you need anything else. Okay. Now I'm back with the next part. Hand hygiene again. And here is where I would document what medication I gave, by what route, or the site of medication. I gave 3 PO meds. I would document my initials and the time and the date that I did it.